Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Hello, my name is Dr. Derek Barron, and welcome to another amazing episode of the Prime Health Podcast. We interview doctors, nurses, wellness experts, and healthcare leaders who are revolutionizing how we approach healthcare and longevity. We explore breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. Today's episode is brought to you by Grow Solutions, where we partner with healthcare professionals to scale operations and grow revenue with AI-driven solutions. So if you want to learn how to take your practice or business to the next level, make sure to stick around, and you can drop some comments below about having a free growth plan consultation by just putting the word growth in below. But what I want to get to today is the star of this podcast. We have an amazing guest today, and you're going to love to hear what we have in store for you. I'm pleased to introduce Dr. Kaleigh France. Dr. Kaleigh France earned her doctorate of nursing practice degree from the University of Central Florida in Orlando, Florida. Nice, beautiful, warm place.
Yes.
Dr. France has extensive knowledge and experience in functional and preventive medicine, hormone therapy for men and women, thyroid issues, weight loss and maintenance, and optimizing metabolic function. Dr. France is passionate about identifying the root cause of healthcare issues and minimizing the use of unnecessary medication. I completely agree with that. Dr. France is an active member of A4M and is continually up to date on the latest research in functional and anti-aging medicine. And before entering healthcare, this is amazing, Dr. France trained to be a chocolatier at the Val Rahona Institute of France and chef at the Culinary Institute of America in New York. In her spare time, she enjoys yoga, cooking, skiing, hiking, and spending time with her son, daughter, and husband. Dr. France was diagnosed with Hashimoto's at 10 years old. Because of her personal experience with Hashimoto, she's very passionate about and dedicating to the treatment of Hashimoto's and other thyroid and autoimmune conditions. So, Dr. France, welcome to the Prime Health Podcast.
Thank you so much, Dr. Derek.
You're welcome. So I kind of read over your bio, but I'd love to hear from you if you give me a little bit of more background, extensive of what really brought you into healthcare, especially that jump from being a chocolatier into healthcare.
Yeah, totally. So I originally started pre-med at FSU, went there for a year when I was 17. So super young, had some struggles with leaving home, came from a family of chefs and I was cooking. It made me happy. So I'm like, let's go to culinary school. And it was great. It was a great experience. I definitely don't regret doing that. However, when I got out of school, started working, I realized what was my passion became a little bit more daunting. They say if you can't take the heat, get out of the kitchen. But it's kind of true. I just felt like there was something missing in that caregiving. I've always been a caregiver. I grew up with a diabetic brother since he was diagnosed with type 1 diabetes at 2.5 years old. So, grew up giving him shots, caring for him, the oldest of 3 kids. So caring for my younger siblings, and actually ended up, there was a very pivotal point in my life. So I was working as actually a barista at Starbucks when I was in my early 20s. And there was a quadriplegic man that would come into Starbucks every day. And he actually was the pastor of our church. I never had developed a relationship with him, but I knew who he was, and I started to develop a relationship with him. And he ended up needing a nighttime caregiver. So I got, on one hand, I had this awesome bartending opportunity. And then on the other hand, I had the choice to go and become a nighttime caregiver to Mr. Chuck Green. And I decided to be the nighttime caregiver. And that really kind of shaped me, and went back to nursing school. So I went to Adventist University in Orlando, got my RN, my associates. Then I worked for a little bit. I actually worked in the hospital, realized that was not for me. God bless you all who work in the hospital, but just definitely not my place to be. So I ended up at that point going into actually my beginning stages of regenerative medicine as an RN. So worked for a company called Selling Biosciences, where they harvest autologous, which is your own bone marrow, as well as your blood for PRP and stem cells. So I was a trainer and a clinical specialist, and I did that for about 3.5 years before, and I got my bachelor's while I was doing that. And then I decided to go back for my doctorate as a nurse practitioner, because I always, since day one, even in the hospital, I saw the people in the white coats and seeing my patients, trying to diagnose them. That was always in my soul. So went back for my doctorate, had a couple kids. Had my son while I was getting my doctorate, and then had my daughter a little bit later as I was finishing it up. And then, that's kind of the story. I went into primary care in Florida. So I am born and raised in Florida, Central Florida. And I was just seeing a lot of sick older people, had a big geriatric population in Florida. And I was, I did my doctorate project on deprescribing, so getting patients off of medications. And again, I was presented with that dilemma in primary care where polypharmacy occurred, or prescribing and patients being on a ton of medications, medications interacting with each other, causing adverse reaction, the prescribing cascade, which, if you say you prescribe this one medication, it causes a side effect, then you prescribe another medication to address the side effects. And it was very daunting. So I'm like, there has to be a better way to practice medicine. And I always was, suggesting different lifestyle interventions. That's always been a core of, I feel like, my nursing education as a nurse practitioner. We're taught the holistic care model. So to address the mind, the body, the spirit, the diet, the exercise, all of that stuff. So I actually was looking for a job in functional medicine. I knew that I wanted to get into that space, didn't really know how. So found a clinic actually in Orem, Utah, went to work there. That's where we moved back out to Park City, Utah. Actually lived in Lehi for a year while I worked in Orem, and trained under a provider, a nurse practitioner running clinic there, learned quite a bit. And then since then, I've just been learning and taking more courses, reading more books, like I said, going to conferences with A4M and other organizations. And then, didn't plan on opening my own business, but, God always has other plans. So felt that urge that, well, if, these people can do it, then I can do it too. And, I really want to provide that quality care that people are searching for. So that's when we actually opened Blue Zone Medical, which is another long story, had to rebrand last summer because Adventist Health Systems, where I went and got my undergrad, they bought the trademark for the blue zones, which are the 5 places in the world where people live the longest.
Right.
And they ended up, their Chicago attorney sent us a not so friendly email, requesting that we rebrand based on the trademark infringement. So we rebranded, which I don't regret. It was a lot of work to rebrand, but we rebranded to Agapex. So agape means selfless love. And that's something that I try to live my life around. Jesus showed everyone selfless love, especially his disciples and the people around him. So I try to, live my life like that. And then we also have apex in the word. So trying to help my patients reach the apex of their health.
I was going to ask you that. You beat me to that question. It was very interesting. I had to practice saying it. You helped me announce it much better, but Agapex, I really like it. Dr. France, can you tell the viewers what's the difference in your credentials, DNP and then FNP-BC? What does that mean?
Yeah, so DNP, so the nurse practitioner degree used to be a master's. Because nurse practitioners are able to do pretty much what physicians can do, a lot of universities have been requiring them to pursue the doctorate. So I do have my doctorate in nursing practice, and I got my degree in family medicine. So FNP is family nurse practitioner. That BC on the end is just a credentialing. So there's ANCC, AANP. I did the ANCC. And yeah, so I can treat literally people from the time they're born until the time they die. Although I do specialize, I would say, in patients that are, preteen and above.
Okay. Okay. Fantastic. Thank you for sharing that for me.
Yeah.
So you said a lot about functional medicine. So what's your take on the difference, or how would you explain to somebody that walks in as a patient that isn't sure, I see my medical doctor all the time, but you do functional medicine. What's your take on the difference between functional medicine and traditional medicine?
Yeah, so traditional medicine, I feel like it's a lot of symptom based. So, you go into your provider, you say, I'm tired or I can't sleep. They give you a pill for that. They don't look at the whole picture most of the time. I would say, maybe there's a few providers, conventional providers, that do look at the whole picture, do more in-depth lab testing. But in school, we're actually taught to do less, which I don't agree with. I don't agree with, only testing certain labs because we're told to. I like to have a big picture with my patients. So, your initial functional lab panel based on your symptoms is going to be at least 100 biomarkers. So we're going to look in depth at your labs. We're going to look in depth at your hormones, your adrenals, your thyroid. We're not going to just check a TSH. And that's one of my pet peeves, honestly. I don't think endocrinologists, if you're listening, check a free T4, check a free T3. It makes such a big difference. It really does in patients, the way they feel. I've checked just a TSH, which is a thyroid stimulating hormone. For those that you don't know, somebody looks like, if you were to just check that they're completely fine, but then you check their free T4, which is their circulating thyroid hormone, their free T3, their usable thyroid hormone, and they have hypothyroidism and they're not feeling good. So they would have not been diagnosed by just checking that TSH. And I literally see that all the time. So we look, in depth, and I feel like those tests aren't superfluous, they're necessary. As far as conventional medicine too, I feel like most providers, again, I'm not going to say all providers, but most providers don't address the lifestyle intervention. So we're very big on that. So the why, is diet good? Do you have any food sensitivities? That's another big thing that I look at. If anybody has inflammation, like their IgG levels for certain foods, the gut health, all of that stuff, it really truly matters. And the more I get into functional medicine, it just reminds me how amazing the body is and how all the pieces and components of the body work together. And if one is out of harmony, we're going to not feel good. So,
yeah. The body was meant to be in balance. We do the best we can to keep it in balance. But unfortunately, the barrage of most people is what you hear on TV, on radio. Podcasts are better because you're getting, better information. But to go from a traditional, I worked with an orthopedic surgeon, and they're orthopedic surgeons that are now getting into regenerative medicine, because it's not just about cutting with a knife or giving a prescription. What can you do prior to that? Because eventually you may need a knee replacement, but you don't always have to start that as your first object. The guy I worked with, that was always his first go around. Granted, it was a few years ago, but that's always his great point. So it's really great. What would Dr. France, what would you say is the biggest misconception people have about functional medicine right now?
I would say the biggest misconception is that it's kind of woo-woo, it's new. I think you have two types of people. You have the people that are very much so into traditional medicine, very much so get your COVID vaccine, make sure you COVID test and wear a mask. And then you have the people that are questioning things, questioning the vaccines. Well, now they're telling us they told us to get the COVID vaccine, but now they're saying they don't recommend it for children and healthy adults. So patients are starting, and people in general are starting to think about medicine a little bit differently. So I think, you still have those patients, and my mother-in-law being one of the, I'm going to bring up my mother-in-law on the podcast, but, she still brings her COVID tests to the house when she comes and her Paxlovid and, is a trained RN that worked in the hospital. So, has a totally different backstory than me. And I'm not trying to judge her or anything. It's just a different way of thinking about medicine. But also it's like, patients like that are often on multiple medications, polypharmacy, they don't know that what they're on is actually causing more harm than good. But I really think there is a movement. I see a movement. I tell people this all the time, that people are starting to seek out other healthcare, seek out functional medicine, because they don't feel good and their provider is telling them that it's all in their head. So
yeah. Way too often. I can agree. I could go on with a few family members as well about COVID and or just health in general. As a chiropractor myself, I was never somebody that told somebody to not vaccinate their children. I always told them that you should learn about it, ask questions. And truly, I said, the only thing I would suggest is staging out, not having 4-in-1 visit. It's not a well baby visit. It's a shot visit. And that's not against the medications that are out there, the people that provide it. They don't know any better because they're not educated. So I think you're right. There is a movement. Of course, there's the MAHA movement that's out there that I think is positioning you in a great place, because people are starting to look for options for themselves. Instead of being told what to do, they want some choice in it. And I think that that's a great position to be in, especially for yourself in the active area of Utah where you're at.
100%. Yeah. And I feel like Utah is ahead and on the forefront of functional medicine. So there's a lot of functional medicine providers. When I lived in Florida, it was very rare to find functional medicine providers, whereas here it's a lot more common. So you kind of have like your, the U.S. is kind of divided between Eastern and Western medicine too.
Right.
So,
absolutely.
Yeah.
So you being in Park City, Utah, your patient population, I'm certain you do. You see men and women and young to old. Like, what is that demographic that you see?
Yeah, great question. So we did some research on this based on our patient population. 85% of our patients are women. So we serve a lot of women. We do specialize in women's health and optimizing hormones, which is a huge issue. My office manager, she does 15-minute consults for us, and it's kind of, she jokes, but it's the same thing she hears every time. I'm gaining weight, I'm tired, I just went through menopause, or I'm in perimenopause and I just don't feel like myself. So we do see a lot of those patients in that perimenopause, menopause. I also see women patients who are trying to conceive and not been successful, to help optimize their hormones for conception. I see some preteens to balance their hormones. Matter of fact, today I have a patient who is a teenager boy and they just can't figure out what's going on with his legs. So a lot of times I'll have the patients that come to me after they've exhausted several resources, and they just can't find an answer. Youngest patient I would say is, well, I treat my kids, so I guess 3 and 6. But as far as that goes, it's kind of an outlier. I like to say I treat preteens, I think my oldest patient is probably around 80 years old. So yeah.
Okay.
Yeah, and Park City is full of patients who want to live long and want to have quality years as they get older. So, they're super active. So really, we're working with our patients to optimize their health so they can stay active as long as possible and healthy, and have that good quality of life as long as possible.
Yeah, if you look back in the 80s, 70s, and 60s when we were on the beach, it was a completely different, visual perspective of somebody walking on the beach versus what's happening today.
Yeah.
And the truth is, that's pharma-led, that's big food-led, it's all of those things that it sure tastes good to have, cherry this or, strawberry that, but there's chemicals that go along with it that cause a terrible reaction in the body.
It's horrible. Matter of fact, I don't know if you're familiar with IgG food sensitivity testing.
Yes.
But myself having Hashimoto's, I did my IgG food testing. I did my son's actually this past week, who he has a few thyroid antibodies. So even at 6 years old, he's, predisposed to Hashimoto's. But I thought it was important to check his IgG levels because maybe he's eating something that's going to cause inflammation that's going to lead to the development of Hashimoto's. So interestingly enough, both my son and I tested very high in the red for IgG levels of wheat, gluten, which is genetically modified, peanuts, peanut butter, which again is genetically modified in most ingredients or most products, and then eggs. So that's something very interesting. And I do think there's a correlation between GMOs, the hormones we pump into our animals, and food sensitivity. So, people joke around, patients say, oh, I went to Italy, I had pasta, I felt great, I lost weight, I didn't have any inflammation. Then I come back to the States, I have pasta, and, I been fatigued for days and have diarrhea and all of this other stuff. And it's because I think we just really, back whenever they was it the 70s they genetically modified wheat?
Starting later 70s, yeah.
Later 70s, yeah. That just really, it's sad, I can't eat bread. I'm a foodie. I love bread,
Yeah.
and I cannot physically eat it anymore. And it kind of makes me upset with the FDA and with the people who, decided to genetically modify these foods. Like, there was no reason for it. We could have produced food and we didn't need to genetically modify them. So
the reason in it is the money that was behind it. Follow the source from where it comes from. When you're overseas, you can eat, drink, and be merry.
Right.
When you're here, you can eat, drink, and lay on the couch.
Yeah.
It's hard to be merry here in the States.
It's so true. So I'm hoping, big fan of RFK. I'm hoping that with the MAHA movement, I already heard it. Is it Nestle, or I think it's General Mills that are taking the dyes. The dyes out of the cereal. Even folic acid. I hope they take folic acid out of the cereals. So hopefully our ingredients will, and our nutrition labels will improve, just because it's hard as a mom too to tell my son, no, you can't have this, no, you can't have that, but at the same time, I don't want him to end up with Hashimoto's,
right.
Or something.
It's really
else.
hard. Our son had gluten issues, and when he goes to a birthday party, it's no fun for him to watch them eat birthday cake. And we said, you can do what you want, but understand you'll have some reactions from it after.
Right.
So he definitely is still a pretty healthy kid, but he'll cheat. He's in college, that's expected a little bit.
It's hard in college for sure.
Yeah. So Dr. France, there's a lot of services that you offer in your practice from functional medicine. We've talked about hormone replacement, weight loss, women's health, IV therapy, regenerative medicine. You do some aesthetics in your practice too. So I think one of the big things that's out there right now is weight loss. And what's your take on the GLP-1s?
So the GLP-1s, so at first I was a little skeptical because I'm not a big med pusher, but literally like the miracle drug. My patients, as far as, not only weight loss, but just moving the needle in so many different areas. So I am able to deprescribe, which is one of my favorite things to do, with even just microdosing GLP-1. So being on a very tiny dose, I can get patients off of their blood pressure medications, cholesterol medications, even something new that I've found personally, because I do microdose myself, along with other patients. And tirzepatide is my favorite medication. Semaglutide I'm kind of moving away from, just because the side effect profile isn't that great. Tirzepatide is pretty benign as far as side effects, but thyroid. So I've been on, for instance, 175 micrograms of Synthroid since I had my son, who's now 6. I'm down to 125 now. My thyroid's working better. My antibodies are down. Just saw a patient today. Her antibodies, since microdosing tirzepatide, she started 3 months ago, have been cut in half. No other interventions really, just a couple supplements, but she was already taking the majority of them. So I think they're great. The biggest thing, and if I could say anything to people who are afraid of the GLP-1s and a lot of the things, the horror stories that they hear on the internet, is it's because one, you have diabetics who take them. They're prone to gastroparesis, which is an intestinal paralysis because they have neuropathy of the gut. So putting a medication in them that slows down the digestive system, they're already prone to gastroparesis. So that will even make it worse. So if you're worried about that, that's the answer to that question. As far as the side effects and patients going to the ER, having pancreatitis, acute kidney failure, dehydration, it's really the provider's not monitoring you close enough. So for me, my patients who get on GLP-1s, I see them every 4 weeks at a minimum. And we determine dosing. We do an in-body scan where we do their body composition to make sure they're not losing muscle. They're losing mostly fat. We go over their diet, their exercise, and just optimize everything. And I'm a big fan of cycling them. So any kind of peptides, cycling peptides. So being on them for a certain amount of time. So say you want to lose 30 pounds, being on them for 6 months, you lose your 30 pounds, get off of them, and then maybe in a couple years, cycle it again. However, the one thing I've noticed is for patients who have autoimmune disease like me, we get off of it and our inflammation a lot of times comes back. So, for me, I've been on microdosing tirzepatide for probably about 18 months now.
Wow. Okay. What about type 1 diabetics and doing any of those situations? Do you know any contraindications with that at all? Or
No. My sister-in-law, matter of fact, is a type 1 diabetic, and she's been on, I think she's been on Ozempic, I want to say, for the past couple of years, and she's doing great. Her A1C's down. She feels great. She's lost a ton of weight, a lot less inflammation. She has MS. Her MS has improved from it. And I do have a couple type 1 diabetic patients. I don't think currently, but in the past that I've had on GLP-1s, and I have seen improvements in their A1C where they don't need to take as much insulin, because when you take more insulin, you develop insulin resistance. So the goal is to not take a ton of insulin. So these GLP-1s help not only type 1 diabetics, but type 2 diabetics to really get off insulin, not type 1, but type 2 diabetics to get off insulin, type 1 diabetics to decrease their dosage. So I do have, I had a patient, just for instance, come in with a A1C, which is the average of your 3-month blood sugars at 10, over 10. I think it was like 10.7. Couple months on the GLP-1s, I want to say like 4 to 6 months on the GLP-1s, and she's no longer diabetic and she's no longer pre-diabetic. She's completely out of the diabetes category altogether. So it definitely is a game changer, but I would say, I feel like a lot of people too, it's a hush thing, and I don't think it should be. I think it's an amazing drug, and I think we should be talking about it. There are, studies regarding the benefits. They're starting to show neurocognitive benefits, potentially even preventing Alzheimer's, dementia, heart disease, etc. But long-term studies, just like we saw, with the COVID vaccine, it's a new technology, it's a new medication. So we're still waiting on those, but hopefully, and I'm thinking, the benefits definitely outweigh the risks.
Good. Love to hear it. In your office, you also do regenerative medicine, and that's a very hot topic these days as well. So you do PRP in your office, is that correct?
Yeah, we do PRP, no stem cells, but just PRP. So we take patients' blood, centrifuge it, extract the growth factors and the platelets, and then we even have this, it's pretty cool. It's called growth factor concentrate. So you can actually take the leftover plasma, put it through a filter, and this filter takes the water out of it. So literally in one syringe, you'll see water coming out of your blood, like clear water. And in the other syringe, it'll create a growth factor concentrate. That's kind of like a more sticky. So it's viscous. So I like using the combination of the PRP and the growth factor concentrate, because if you're putting, just say we're doing a knee injection, you're putting the PRP in the knee, putting in the growth factor concentrate either first or last will help the PRP to adhere to that area. So it's better able to heal. And we use MSite. So I'm big on cell count, and MSite has one of the highest cell count systems. And learned that when I was in PRP and stem cells, that cell count definitely matters. So I know a lot of clinics just use the test tubes, but we don't do that here. Our device is top of the line.
Fantastic.
Yeah.
So for patients, no matter whether they're coming in for whatever service you may offer, are there some patients that you would potentially turn away? In other words, how do you determine if they're a good candidate for your services, specifically functional medicine?
Yeah. So basically, I feel like most patients are candidates. However, we will do a consult. Leah does, my office manager does the 15-minute consults, and we have had a couple patients where it might not be a good fit. Say they're seeking more, or I would say less natural approaches, more pharmaceutical, or they don't want to do the advanced testing. For me, in order to get the whole picture of your health, I need to do advanced testing. So if they're not open to doing that, if they only want to use their insurance, which a lot of insurance companies don't pay for these advanced testing, even your general labs they won't pay for, then unfortunately we really can't help you. And I do run into the patients who it's, difficult to treat them because they have something in their mind that is wrong with them, and nobody can treat that. So I've also had a couple of those patients too, which, it's difficult to part ways, but sometimes you just can't help people, and you can give it your all, but at the end of the day, it might not just be the best fit.
Yeah, they've got to be willing to be helped. And instead of just coming in to pop another pill or take another pill, there's some steps that they've got to take control of their life, and you're a conduit to help them do that. So
Exactly.
Let's kind of talk, Doc, about science and innovation for a second. So What do you think is the most exciting breakthrough you've seen in functional medicine recently?
The most exciting breakthrough. I like the OAT test, the organic acids test. I think that's something that's being utilized more. It gives you a brief snippet of your health in several categories. So stress categories, toxins category, gut health, methylation, as well as mitochondrial health. So I feel like it's a good starting point test if somebody if we want to get an overall picture of everything. So I think that's, and I don't know how long the OAT's been around. I've only been using it for the past year or so, but that's a great test. I also think gut health testing has improved significantly throughout the years. And we're seeing, more advanced tests like the GI 360, gut Zoomer, et cetera. So I think I'm excited to see what advanced tests. I know there's a new one that determines your biological age too. I have yet to dabble into that one, but it looks exciting. It's a little more expensive, but I think that's a cool one too. I'm a big fan of Kara Fitzgerald and in her biological age studies. So yeah, I think we'll just, continue to advance our testing and our treatment options. I think the supplement companies are always improving and getting new supplements, new herbals to treat these conditions. So I love that we're able to have resource to all those supplements. I use FullScript a lot. So FullScript is awesome because you literally have like a dispensary of supplements. Have you used FullScript before? Yeah. So I think technology wise, I don't know if I'm missing anything. What is your favorite, or what do you think about the?
I think it comes down to patients and what they're willing to do, whether it's expense or not. Most are okay with a cheek swab. They're okay doing some of that. Do they want to take a stool sample? They think that that's awful invasive and disgusting. But what you can get from that yourself is so beneficial in the future. So I think it's individually dependent, psychosocial dependent on their, and, it comes down to finances. So you've got to find a way in which people can do that for themselves and what they feel comfortable in doing. But, there's with the intervention of AI as well, there's so many things that are coming out to help people. It's a lot to catch up on, but there's so many ways in which a provider can help, like in your situation. And when you look at it from, if I hurt here in my hand, it could be something up the chain a little bit. It could be your gut that's causing it. We need to look at it from a full thing instead of, if your hand hurts here, open it up, let me put a pill in it, and that's going to help swallow it. It's not quite the same.
Exactly. Yeah.
So from a growth and business development perspective, you're a business owner, and that's not an easy task as a young woman that has young children and a family. How do you manage the highs and lows in your practice?
Yeah. So it's like I said, it's been a whirlwind since we started the practice. We, moved from a Lehigh location in Utah Valley to Park City. We rebranded. So there's been a lot of highs and lows, a lot of learning experiences. For me, it's personally staying grounded in Jesus, keeping my faith, praying, getting enough sleep is huge for me. I'm a big sleeper. I have to get my 8 hours every night or else I cannot function. And then just really trying to balance things. I take off Wednesday. So Wednesday is my admin day. And that's my day to regroup. So on the winter I go skiing, the summer I'll go for a bike ride, just to kind of have some me time, because I don't have very much of that, having, seeing patients all day and then having my kids and my husband after work. So, and I am an introvert naturally. So it's nice to have the Wednesdays where I can kind of decompress, and deal with everything from the week. So it's nice having, the 2 patient days, a break, and then 2 more patient days in the weekend. I find that's a really nice workflow for me. So yeah, a combination of those factors helps me to stay grounded.
I would have never pegged you as an introvert. You're a great communicator, so I wouldn't put you in that position, but I also don't walk in your shoes too often. And I love the fact you bring up faith in your practice. So for your practice, I know you've gone through some challenges, as you said, but what's the biggest challenge that you've had in building your practice?
The biggest challenge. So the biggest challenge I would say actually is finances. Our economy is a little tough right now. So, managing inventory, managing what we're going to charge our patients. So we started off really cheap. And I kind of undervalued my services. And so having to, when we rebranded, change our pricing and our model, it was a little challenging. We did lose some patients, but we've also gained some. And, my husband always tells me you have to value your time and you have to value your expertise. And I've learned throughout the years to do that. I think a lot of us, even as providers, can kind of undervalue ourselves, especially younger providers. But now I'm to the point where, I have to, money is time, unfortunately. I wish money wasn't a thing, and it won't be someday when we're in heaven, but for now it is. And in order to keep our doors open, we do have to charge a certain amount, et cetera. We're not, trying to take advantage of people by any means. If I could charge, $99 a visit, I would. I just, financially we can't. So I think that's really, and I think for a lot of people, finances is probably one of the top struggles, as well as employees have been another thing. Just finding and retaining good people. That's been hard with good work ethic. So I think those have been my 2 major challenges as a business owner. Not my patients, not my practice, just kind of those business things.
Yeah. I haven't had my practice for quite a while. I don't know how I would handle the workforce that's out there. From speaking with other practitioners and understanding the struggles that they go through. So people trying to find an employee or trying to find another healthcare professional to work with them and the expectations that they have coming in, it becomes very difficult. So for your practice, Dr. France, from a goal perspective, where do you see your practice in the next 5 years?
Yeah. So in the next 5 years, I would love to, my husband's kind of idea, and I'm not sure if this is where it's going to go. I think it sounds cool. If it'll be ski towns or what, he's like, he wants to open Agapex in different ski towns, which could be a potential, but, looking to open different locations. And one of my passions is training and teaching. So I love training and teaching providers. We actually had a practitioner I trained in functional medicine who worked for us last year. And I love doing that. So we have a medical assistant who's going to med med school right now, and she's training under me this summer. So that's part of my passion, is teaching and training. So I do see that, and I would love for Agapex to expand to multiple locations. It says in the Bible, many are the man's plans, but the Lord orders his steps. So, you can always have plans, but it's ultimately up to him what happens. So I'm just working hard, trying to take care of my patients, and we'll see what doors open in the future. So
I love it. You make me, I read the Bible, but you made me look at it as to, I've got to start memorizing some good verses. That was a very good verse, what you said. What advice would you give other nurse practitioners that are your general or typical, I don't mean to put them in that category, or other, physicians that are out there in potentially adding functional medicine or adding regenerative medicine to their practice? Would you advise that?
I think it's great. I really do. The one dilemma I think that they will come into, which, I've seen, I'm a part of several functional medicine Facebook groups, is the insurance dilemma. So when you're doing functional medicine, do you continue to accept insurance if you're still practicing conventional medicine? I think there's kind of a tug of war going on between the insurance and the conventional and the functional and the cash pay. So at some point in time, you're going to have to decide. And I think in the beginning, you should decide whether you want to accept insurance as a functional medicine provider or whether you don't, because there is, insurance unfortunately dictates how much time you can spend with patients, what you can do, prescribing, chart notes, etc. So my biggest advice would be to make that decision before you kind of delve into that. And you can incorporate, and to get your education, start learning, pursue knowledge in functional medicine. One of the best books that I think, this book is great. So I don't know if I think she's actually, she's a chiropractor, Dr. Zachary. Lab values. So this is a gut one. They have one on gut. They have one just on general lab values. So that's great because it looks at optimal ranges instead of normal reference ranges. So just kind of starting to think differently about how you look at and interpret labs might be a good thing. Because, for instance, we take vitamin D. Vitamin D is not considered out of range until it's below 30. However, somebody's going to be feeling pretty crappy if they're in the 30s. So, optimal would be 70 to 90. So that's, something you can do as a conventional provider in a functional way to really make a difference.
Your practice journey is amazing to get to where you are, from the personal things that you've done to get to that point. You are extremely knowledgeable in the service from many of the other people that I've had conversations for. You're faith-based. I mean, there's so many things that are going right for you in your business. And I hope that, it does grow for you moving forward. I can't see how it isn't going to. We are our only limitations. So and, true. There are ways in which we have to find our way around that. So from like a business perspective, if you could wave a magic wand and make one thing better in your business, what would you request? Robin Williams pops out in his blue little genie lamp. What would you ask him to grant you for something being better in your business?
For something being better in my business, I hate to say it, but really it's just, having that, not having to worry about the finance thing. It's tough as a business owner. And just, having to say, okay, we don't need to buy this or we don't need to do that right now because we need to focus on this. So really just, having I don't say unlimited supply of money, but wish for $1 million, which, it comes in time. It's really, we actually put a good amount. We sold our house in Florida and put all of that money into the business.
Oh my.
So we put, blood, sweat, tears, everything, into this business. And, it's continuing to grow. First year made some, I wouldn't say poor financial decision, but just learning, had some learning experiences. Mm-hmm. So I think for me, just, not having to worry about that money, which, God's telling me that'll come in time. So I'm trusting him on that.
Okay. Love it. Wonderful. Can you, from a patient success component, what's been your most rewarding professional milestone from a patient's perspective? Like what's that, when somebody says, what's functional medicine? Well, let me tell you about Tom, or let me tell you about Jane. What's that most rewarding patient result you've experienced so far?
Yeah. So the most rewarding, I can't think of a particular patient off the top of my head, but whenever somebody comes in, and it's a pretty common thing in our practice, and this is why I continue to do what I do. Somebody comes in and they're just like, I want to thank you so much because I finally feel like myself again. I finally am able to have the energy to play with my kids. I can sleep better. My anxiety's improved. My quality of life is so much better. My relationships are better. So for me, it's not one particular patient comes to mind, but really the group of patients, and the common theme and the thing that I hear the most is that I feel so much better. I feel more like myself, and just the thank you. And that's why I do what I do.
It's wonderful. Hearing how you affect their life, you do from lab results, or you do from what you see. They don't always see what we see, but when they can tell you that I can play with my grandkids, I can play with my kids, I can do more of the fun things again, that's extremely rewarding. The money comes without a doubt, but it's extremely rewarding.
100%.
A couple more questions for you, Doc.
Yeah.
And I'm going to allow you to kind of brag on yourself here a little bit, but what would you say, how can you explain to patients about realistic outcomes? They've been struggling with their primary care provider. They're not sure they've got an autoimmune disease. They think they do. They're struggling. How can you say, well, he gave me or she gave me a pill, it's not working. Can you fix me in 3 days? Like, how do you handle those expectations?
My motto, I should say, is, and I should put it on my wall here, I need to, progress, not perfection. So, it's not going to happen overnight. It's progressive. So, and I don't like to start a lot, you go to a lot of functional providers and they'll start you on 10 different supplements all at once. I don't like to do that, because if you have a side effect from something, you don't know what it's from. So for me, I like to start things kind of slowly and just intervally, if that's a word, in intervals. And so patients can tolerate them, so they know that they're not having side effects, etc. So it's not going to happen overnight. And I'll say it's going to be a journey. I preface it with, it's going to be a journey. It's progress, not perfection. So we'll work on, balancing this, then we'll work on this. So it's definitely stages. I usually tend to, work on hormones, then and adrenals, then we'll go to gut health, then maybe neurotransmitters or mold detoxification, etc. So it's important. I feel like it can overwhelm patients if they're doing too much at once too. So I've found in my practice, I like to do things a little bit more slow, because it becomes more lasting. It lasts longer, the results.
Okay, Kaleigh, what do you feel that you at your practice, you do better than anyone else in your community or the surrounding communities?
Mm-hmm. I would say lab interpretation. I'm kind of a geek when it comes to lab interpretation. It's my favorite thing to do. So looking in depth at labs, just, blood labs, saliva labs, etc. I think that's my jam. And I did learn, I was in the clinic in Orem that I was working at, we only did blood labs for topical hormones. And I put the blood labs and the saliva labs side by side, and I started to continue my education after working at that clinic. I'm like, wait a sec, we should be doing salivary testing. And it was so true, because it looked like the patient on the blood labs were way underdosed, but then on the saliva labs, they were high, so on their hormone levels. So it just goes to show that the modality of lab testing really matters too, whether it's, urine, saliva, or blood. So that definitely matters.
Okay. How can someone get a hold of you if they're interested, if they have a question about their practice, or if they have a question about what can I do? I think I have X, Y, and Z problem, to set up a consultation or an appointment? Where can they find you?
Yeah, great question. So you can go to agapex.com, AGAPEX.com, and we have a button for a complimentary 15-minute consultation. So that will be with Leah. And if you have any particular questions for me, you can ask her. She can relay it to me. You can also email contact@agapex.com, and we will get back to you.
All right. Well, Dr. Kaleigh France, I want to thank you very much for your time today. I get educated every time I have a new guest on, so I appreciate it.
Yeah.
I love the faith base that you have behind it. I love how you said that's my jam. That's great. How you are when you're digging out when you're trying to get somebody the best health they can, and you're inside of the numbers, looking at their lab results. That's important for people to understand that you are there for them. So I commend you for doing that. So again, thank you very much for sharing your insights and your expertise with us today. Your unique perspective on what you've been doing in your practice and in your community is, unparalleled. I'm sure. I don't live there, but from our conversation, it sounds fantastic, because the spectrum of what you're doing to help other healthcare professionals by, bringing people in to help them grow. And from a personal and business perspective, I appreciate what you shared. So from our listeners, if you found today's conversation valuable, please subscribe to the Prime Health Podcast on your favorite platform. And if you're watching on YouTube, subscribe, click that bell so when the new one comes in, you get notified of it. If you feel it helpful, share this with others. We'll be back with another healthcare professional that's changing lives and cutting through edge and giving us cutting edge treatments. So until next time, stay on the forefront of your wellness journey. And if you are, for our practitioner friends, remember the best time to optimize yourself in your practice for personal longevity is right now. So again, Dr. Kaleigh France, thank you for your time. I appreciate it.
Thank you so much, Dr. Derek.